Hey YouTube. So I wanted to start this channel for anyone that may be going through or just starting treatment for thyroid cancer. I was diagnosed a year ago with stage 2 thyroid cancer that then metastasized into lymph nodes. I'm hopeful that this video may find its way to someone who's just now being diagnosed or someone who's going through these treatments that are terrified or have a lot of doubt or have questions or, just looking to find some information. Absolutely, I know that every case is different. Every form of cancer, every person goes through treatment differently, but I just wanted to share my story in case there's some similarities that maybe could help you through the process or put you at ease with what's to come if you haven't gone through it already. And yes, I'm French, so I talk with my hands, but I'm going to try to refrain from that. So like I said, I was diagnosed a year ago. Next week will be a year exactly when I got the diagnosis. So let me back up a little bit here. So what first happened is I had some, swollen lymph nodes on my neck, a bump. I just had a bump on my neck. So I asked my primary care doctor, hey, I've got this bump. Obviously, it's not normal that it's there. It doesn't cause me any pain, but I'm not sure what it is, or, asking the professional, is this serious? Should we take a look into this? So I was told at that time that unless it's causing me pain, not to worry about it. Looking back now, I've changed doctors, and only you know your body. If something is wrong, something doesn't feel right, you have to advocate for yourself. No one else is going to. It's just that simple. So shame on me for not following up. Basically leaving my mercy to thinking that the doctor was going to say, yeah, there's something there. So fast forward, now I've had the bump, year goes by, went down a little bit in size, another year goes by, came back to the original size, another year goes by, I've had my physical exams, everything's looked fine, blood work's fine, everything's functioning well. So here we are now, 4 years past this bump hanging out on my neck here. And I, at that time, brought it up again and was sent to an endo doctor. So if you don't know or aren't going through this process yet, you will have a PCP. You may or may not have an endo doctor. You may or may not have a cancer doctor. You may or may not have an ENT doctor, ear, nose, and throat. In my case, with my treatment plan, I just had my primary, the endo doctor, and then also a surgeon. So I never had an ENT doctor or an actual cancer doctor. So I want to make sure I give you guys all the right information, so bear with me here. Okay. So anyways, I'm sent to the endo doctor. Endo doctor does an ultrasound of the bump that I've been talking about. Now, along with this bump, I did have other symptoms, but it wasn't directly linked to this bump. I mean, I had extreme fatigue, which could be anything, apparently. I did have issues sleeping, and sometimes it was insomnia, sometimes it was the opposite, and I just slept all the time. I had brain fog. Like you are going to go to the bathroom and then you forget why you went to the bathroom. Clearly it was to go to the bathroom, but was that really why? Like, stuff like that. A lot of anxiety, which mostly I know that's brought on by stress, but that's a whole nother topic of conversation. So anyways, these are some of the other symptoms, but if you put all those symptoms together, it doesn't necessarily mean, hey, there's something wrong with you. Like, a lot of people are completely healthy and have anxiety and have sleeping issues. But so anyways, we do the ultrasound. Now, the ultrasound finds that, yeah, it's a swollen lymph node. Apparently there's more than one. But in my case, I just have, one that is protruding my neck. And again, I was told if there's no discomfort or pain, then it's not a big deal. Should I have listened to that? No, absolutely not. So once the ultrasound was completed and they did see something in there, more than one lymph node swollen, to them it looks suspicious. So your next step in the process is to have a biopsy done. Now, biopsies, there's a lot of mixed reviews with biopsies. Some say they're absolutely painful, some say they're piece of cake, nothing. So again, this is just my experience. I'm just hoping that taking someone through these steps that they can kind of gear what is going to happen to them, what are the steps they're going to take, because in my case, I was very uneducated about what your thyroid does. I was very uneducated about my treatment plan. I mean, in terms of, I knew, okay, I'm going to see that doctor next week and I'm going to see that doctor next week, but I was not educated at all on what is this appointment for? What are we doing at this one? What's my next step? And that to me is, maybe it's partly because I didn't ask some of these questions going through, but again, because I didn't realize what I needed to be asking. I didn't know anything about this. So I'm, again, hopeful that this video will be educational to somebody who's just going through it, or someone that has gone through it and is seeking some comfort, or, you can feel like you're not alone, because I personally feel like this cancer is huge, 90% in women, and it's just not talked about. People don't talk about it. You don't hear about it. And it's still just as scary as being diagnosed with any other type of cancer. So regardless if a doctor tells you it's the good cancer, there's no good cancer, and nothing good comes out of it. There's no treatment that is comfortable. And the only thing I can say, however, is that it is very treatable. And there's about a 98% success rate depending on what stage you're in. And again, I am at stage 2 thyroid cancer. Okay, so we'll get back now that I went on my little spiel. So you have a biopsy done. Essentially what they do is they numb the area of where they're pulling the biopsy from. In my case, my biopsy, I felt nothing. But again, my thyroid was not biopsied. My lymph nodes were biopsied. In this case, I had 2 over here that looked suspicious. Again, one was protruding, the other one they found underneath, so they wanted to check both. Now, when they do this, they go in and they numb the area with a small needle. You don't feel it at all. I didn't. Then they go in with another needle via ultrasound machine to pull cells and to pull from these lymph nodes, or vice versa, your thyroid. It's the same process. So once they have that information, then they can send that out to a lab to be tested. Now, in my case, it wasn't directly, hey, it's your thyroid, you have thyroid cancer. So my cells were sent out. They did come back that they were positive for a papillary carcinoma, which, if you're new to this diagnosis or treatment, papillary carcinoma is a type of cancer. There are 4 different types. Papillary is at the bottom of the scale, which is very common. And in this case, it goes in 4 stages, 1, 2, 3, 4. From what I've learned, is that the staging is based off age. So it doesn't particularly matter that you have it here, here, and here, or So if you have it here, here, and here, and you're under 25, it's stage 1. If you have it here, 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 and you're from 25 to 45, it's stage 2. So, I mean, it's pretty similar to that. I mean, for me, that information was kind of irrelevant. I mean, when I was given that information, I was just like, okay, well, what does stage 2 mean? Does it mean it's not treatable? Or, because again, when you think of other cancers, you know, like typically a higher stage, you know, the lower your chances are for treatment and so forth. So this news was absolutely shattering. So let me back up a little bit more. Sorry, my hair, you guys, is just like crazy today. So I have the biopsy. The endo doctor calls. You know when a doctor's office calls and says, do you have some time to come in today so we can talk about your results? It's probably not good news. Because if it was, they would just tell you over the phone. So at that point, I just said, hey, doctor, you know, yes, I can come see you today, but just be straight up with me. Do I have cancer? And he said, yeah, well, yeah, you do. However, it's very treatable, and we need to talk about it, go over your treatment plan, yada, yada. So, okay. So at that point, your body is numb. You don't even realize the information you were just given. You only hear the word cancer. You are like, holy shit, am I gonna die? Did I do this to myself? Like, could I have prevented this? I mean, your mind goes nuts. And especially for somebody with anxiety, it's like 5 times worse. So not only did I get that information, but then you have to carry that information to your family. I mean, some people prefer to wait. Some people don't want to tell their family. They want to know details, blah, blah, blah. I called my fiance. I told him. He's my support. So anything happening with me, he knows. He's the first to know. So that was probably the heart through the whole treatment. Again, it's been a year. And so far through the whole treatment, the hardest thing for me was to make that phone call to him that day. Because even though you say, oh my God, like, am I going to be okay? Am I going to die? Like, some people are different. But for me, my first thought was, am I going to leave these people behind? Like, I'm more worried about him and my family. And how are they going to cope? Like, what are they going to be like through this treatment? And my main concern was them. It wasn't me. I wasn't focused on me. And, you know, at that point in time, it was like I just heard cancer and I just thought, oh my God, my family and my loved ones and my friends. And that's just me. So you get this information, then they bring you in and they explain everything to you. Well, for me anyways, they explained everything in medical terms. Like, I'm not a doctor. You're showing me graphs about percentages of treatment and, you know, this type of cancer. And then they start throwing out words like, you know, like sciatica, which is like, you know, it's a short word for thyroid cancer that some of these doctors use. And like, first of all, 2-3 hours ago, you told me I have cancer. That's all that's in my head. And then I come in and you're showing me charts and you're giving me statistics and talking about age groups. And it was madness. Like, that appointment, I'm surprised I even remembered some of the stuff that was happening, because at that point it was very not sympathetic, or, I mean, the doctor's not a counselor, but still, I mean, if you're being diagnosed with that and you're being told you have cancer, yes, you want all the medical information, but when you're told 3 hours prior that you have cancer, you don't want to look at freaking graphs on a computer. And half of the graphs you don't understand because you don't understand what the type of cancer is you have. You've never even heard of it. Like, in my case, I didn't even know what a flippin' thyroid did. Like, maybe I'm the only one out there, but who knew there was a little butterfly-shaped thing in there that controlled your whole entire body? Because it does. It controls your whole entire body. So anyways, then they start throwing out words like, oh, well, you're going to have a neck dissection. And you're actually going to have 2 neck dissections. And we're going to remove your thyroid. So let me back up a little bit more. So how they know I have thyroid cancer due to this swollen lymph node bump is the only way for thyroid cancer cells to be in lymph nodes is it would come from your thyroid. That type of cancer starts in the thyroid and it metastasizes out. So it's not like, hey, you have a little bit of cancer in this lymph node, let's remove it. Like, it actually came from somewhere. It didn't develop on its own, that area. So this, now at this point, because I'm confused sitting at the appointment, well, okay, I have thyroid cancer. How do I have thyroid cancer, but it's in a lymph node? Like, I don't even understand that. So that needed to be explained. And then on top of that, they say, well, we're going to remove your thyroid and do neck dissections. At that point, I didn't even know what the heck a neck dissection was. All I heard was neck, and then I was showed pictures on a computer. And oh my God, all I saw was somebody wanting to slice my throat. And I thought, yep, that's it. If this cancer doesn't kill me, when that doctor goes in and cuts my throat, that's it. That's it. People don't, you know, like, when people slit your throat, like, you don't survive from that. So anyways, and again, this is all just my experience. So, I mean, I'm sure there are, again, it's just not talked about, but I'm sure there are other thyroid patients out there that have had a similar experience, have had a better experience, have had a worse experience. I'm not here to judge anybody. I'm not here to say anything I say is right or wrong. I'm just here to share my story, to hopefully help somebody out there that may be going through this or has gone through this, that needs a support that I didn't, that, you know, that you don't have, that I did have. I mean, my family was a savior. Again, some of these doctors I saw were not so great, but I'll get into more of the story here. I did have some, you know, very good times too. So, or good experiences, not good times, because none of this was or is good per se. So I'll get to that part too. Hopefully I haven't lost you or I'm boring the crap out of you. Really, again, I'm just hoping this is helpful to somebody, because when I was diagnosed, for the love of life, if someone had made a video like this and told me what to expect, what was happening, what are you going to go through, my anxiety probably wouldn't have been as bad. And I would have known from the beginning that a year from now, I'd still be here. So again, I'm just hopeful that this reaches somebody that needs that support or that help. So you're told you're going to need thyroid removal and neck dissections. So a couple different things that they don't tell you and you're not aware of up front either. You can have thyroid cancer and it just be in your thyroid. Thyroid only. What they'll do, they'll go in, they'll remove the thyroid. At that point, if it hasn't spread anywhere, you're good to go. Your thyroid's removed, the cancer's gone. They'll do another scan just to make sure that there is no cancer left in your thyroid bed, because even removing your thyroid, there is still some tissue, residual tissue, that they cannot get to. And there is a chance that there may be something microscopic, you know, still in there. At that point, the cancer is gone. From what I've been told or read, I could be wrong, but you have to be 5 years completely free of disease before you can be considered in remission. So at that point, you could be, you know, free of cancer, but technically you're not cancer free or in remission until you hit your 5-year mark. So that's one thing. I've met a lot of beautiful people through some Facebook networking pages for thyroid cancer that have gone through that operation where it was just the thyroid, bada bing, bada boom, done. Now they just get monitored and they watch. They watch to make sure nothing comes back. So if you're not already part of these groups, I advise you, please add yourself to them. There's a thyroid cancer awareness group, something you may or may not need. There's another group called LID. You'll want to add yourself to that, and I'll get into that as well, what that website is for. But there are outlets out there. In my case, the timing probably wasn't so great. When I joined these groups, it was more like, you know, I'm getting ready for treatment, and a lot of these other people are too. So some of them can answer some of these questions, but most of them are in the same boat as me. So it's like, it's very good for support to have somebody to talk to while you're doing it. But again, it didn't tell me or make me feel at ease knowing that, you know, hey, I went through this and this is what happened to me, blah, 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 blah. Again, these people that, it was kind of like more of like, hey, we're going to support each other while we go through this treatment. But for me, I was clueless. I was like, I don't even know what treatment is. Like, I've just been told I'm having a neck dissection. I don't know what that is. So, that was in August of last year when I was diagnosed. My ultrasound was the end of August. My first surgery was September of 2017. Now, my first surgery was complete thyroid removal with a left neck dissection. So what that means, I'm going to stupefy it because I didn't know what that meant. They cut from here to here. Here they cut to remove the thyroid. And from here to here they cut to remove those lymph nodes that had the cancer in them. And when they open you, so 2 lymph nodes were found on there to have cancer. But in fact, if they find others in there that look suspicious, they'll remove them at that time. So in my case, there were over 100 lymph nodes removed from this side. All of them not cancerous, but because they look suspicious, they're removed. They're then sent to a lab, and they then tell you how many out of the 100, which on this side, if I remember correctly, there was about, it was either 30 or 50 some odd that were cancerous out of the 100 they took. So that's surgery 1. Surgery was about, oh gosh, now I need to remember here. Surgery, I believe, was about 4.5 hours. And recovery time, I spent 2 nights in the hospital. So here's something else to know about this that I was completely blindsided about until I woke up from surgery. When they remove your thyroid, you also have what's called parathyroids. You have 4 of them. Okay? They're like embedded, I believe, in the side of your thyroid. So when they remove them, there is a chance that they can damage the parathyroids or they can be removed while removing the thyroid. In my case, I have either 1 or 2 left in there. So what that means in layman's terms is that you need to be on a calcium enhancement for the rest of your life because the parathyroids help regulate your calcium levels. Again, I didn't know anything about that until I woke up from surgery, and they said, well, we think you have 2 in there, possibly 1. Again, I mean, you're going in there and taking out a bunch of stuff. I don't blame anybody for that. I just was blindsided that I wasn't aware that that could happen, you know. But again, maybe I didn't ask the right questions at my, you know, pre-op appointment, but who was I to know anything? So, back to that. That's why I spent 2 days at the hospital for recovery. It was painful, but in my experience, I could talk. I didn't feel hoarse. Sometimes you get a hoarse voice after. I didn't have that. My calcium levels were low, so that's why they kept me an extra night. Typically, I would have had a 24-hour stay. In this case, it was 48 hours because the calcium levels were low. They need to give me meds to get the calcium level back up, and now I have to take calcium every day for the rest of my life. Also, I need to take thyroid hormone for the rest of my life, and if you don't take it, yes, you can die. I've seen many people post, well, what if I just stopped taking my thyroid medicine? Would I feel better? No. Like, your body doesn't have a thyroid anymore. The pill that you're putting in your body is replacing what your thyroid was doing before it was taken out. Yes, you need a thyroid to survive. If you don't have the thyroid, you need the hormone to survive. Why even question taking it? Like, the doctor's telling you to take it, and the piece that was in your body that used to function is no longer there. Why even question that? Just do it. If you're not on the right dose, talk to your doctor. There's different doses. There's different brands. If you don't feel good, if something doesn't feel right, again, advocate for yourself, but don't play doctor like yourself. Ask these questions to the professionals, and if you're not getting the answers, then change your professional, because you have that right. Again, you have the right to advocate for yourself. So, surgery 1 happens. In my case, I had what's called a drain, which means they make a small incision here, and it's a drain tube that's run up. What that is to release and allow any of the excess fluids from surgery, and also removing lymph nodes to drain out, so you don't get an infection. In my case, I felt that the drain was the more annoying part of the recovery from the surgery. And here's why. Yes, you have an incision here, but you have now been cut. Nerves have been cut, so I was numb. A lot of this, a lot of discomfort, but again, the real pain was probably the first 24 hours, but again, it wasn't like pain, oh my god, I can't take this. It was like, give me an Advil, or, you're in the hospital, they're trying to shoot you up with painkillers. But anyway, the drain was annoying to me, because when you come home, you can't get comfortable with that flipping thing. Like, you can only lay one way. Like, hey, you can only lay on your back. You obviously can't lay on this side. Like, you're sleeping on the opposite side till this is healed. But you can't get it wet. So, in my case, I could barely lift my arm, so I couldn't bathe myself. Thank God my fiance was comfortable doing that. But the drain was, I had that drain for 7 days. I had my follow-up appointment with my surgeon 7 days after, and they were able to remove it. Didn't feel anything when they removed it. Didn't have any pain when they removed it. Okay, so here we are, September. Now, I'm told, because before surgery 1, the surgeon did an ultrasound. Well, the surgeon will check your whole neck, not just one side. When the surgeon checked my whole neck, at that point, there were lymph nodes that were suspicious that were found over here. So, again, another biopsy, because obviously they're not going to go in if they know for sure that it needs to come out. So, at that point, I now have to have another neck dissection, but on the opposite side. So at this point, my thyroid's gone. This part's done. This side's done. They now do a neck dissection, and I just want you guys to see, like, what it is. If I can get a good light here. So, they now cut from here to here, where that like original cut was on this side. That way they connect, so there's not two different crossing lines here, you know. So in this case, this surgery was, I want to say, I think it was about the same time. It was about 4 hours, 4.5 hours. That was an overnight stay. At that point, I knew what to expect being cut over here, kind of, except that here, they start here and cut down. On this side, they start almost directly under your ear and cut down. So this was a lot larger incision, but not as much was taken from this side. So this side, I'm sorry, this side, that surgery, I can't even remember how many lymph nodes were taken out and how many were positive. But they took a bunch. Some were positive, some weren't. But again, this didn't feel, I'd say, I don't think this side had as much bad stuff as this side. But again, this incision was a lot more, it was bigger. So for me, this side was a little bit harder to recover from. But in terms of knowing, hey, you're going to have a drain, you're going to be numb, blah, 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 like, because I experienced that over here, I already knew what was going to happen over here, because it was pretty much the same thing. So at this point, that surgery was in, when was that surgery? That surgery was in October. So here we are, August, diagnosed with cancer. September, surgery 1. October, surgery 2. Now, that's crazy. Like, I understand you've got cancer, you want to get it out, it's the right thing to do, but again, you were told 30 days ago you have cancer, and guess what? Now you've had 2 surgeries, and you still don't know what the hell is going on with you, and what your next step is, and do you have, you're going to have a surgery and you have 6 months to live, or are you going to live forever, or what, you know, it was just crazy. Like, that feeling alone of just being so not know what the hell is going on, that was probably the worst. So hopefully this video will find somebody that doesn't have to feel the way that I did. Like, you know, shock, I guess would be the best word. Just total shock. So anyways, diagnosed August. First surgery September. Second surgery October. So I'm going to leave this video there, and then I'm going to come back and we'll do a part 2. Because if I don't get something to drink right now, I'm probably going to pass out. So let me take a little break here, people, and we will resume. See, you get brain fog. Like, we'll talk about that too in the next video. But we'll resume starting off after my second surgery in October, and we'll continue with my path of how everything went. So, if you haven't yet, subscribe, like the video, and go to part 2.